What keeps you up at night? The thought of dying a painful, protracted death? Me too. I blame the state of our nation's health care. And even though we're supposedly all covered, we can keep our doctors and everything's fine now. It's obvious we're still in a state of flux. And that's putting it kindly. Patients are getting hammered with taxes and uncertainty. Doctors have to answer to an even more centralized bureaucracy, and insurance companies are somehow being subsidized. It's enough to make you wake up in a cold sweat. Healthcare on life support. Someone's got to fix the sick system. We'll have some doctors to poke around inside over the next hour, including Dr. Ron Paul. This is The Independence. Hey there, I'm Kennedy, along with Reason Magazine editor-in-chief Matt Welch and Camille Foster from Free Think Media. We are The Independents. We reject both major political parties. We have our own ideas about healthcare and everything else, and it seems only right to have one of the greatest human beings who knows not only the inside of medicine, but also the inside of the body politic. Our first guest is Dr. Ron Paul. Dr. Paul, welcome back to The Independence.
Thank you. Nice to be with you.
Excellent. So let me ask you, I want to take it back in history. What made you want to become a doctor?
Very interesting. When I was young, I was aware of World War II, and especially Korea. It bothered me. I became very strongly anti-war, and I was convinced in my own mind that I would never be able to pick up a rifle and shoot somebody else. And for that reason, I thought I anticipated, even as a young person, that there would be a draft. There was a draft in World War II, Korea and Vietnam. And I thought, well, if I get drafted, I will not use a rifle. I thought, well, I could stand the thought of taking care of people. And that was a strong motivation. I was good in science, so it came together, and I made the decision that being a physician made a lot more sense to me than being vulnerable to the government. So you know that even then I have a resistance to what the government was telling me what to do, and I certainly have resisted what the government wanted to tell me what to do in my practice of medicine.
All right, so what has gotten us to the point where we now have Obamacare? How did healthcare get so bad that people thought the only solution was a new massive entitlement?
Well, it's always that one thing. There's always benefits. People like to get a free lunch, so they're teased with saying, you know, you can keep everything that you have, but we'll pay your bills for you. And a British doctor in the 1970s told me once, he said that, and when I asked him, well, why will the doctors go along with this? They won't get into it and let the government get the doctors involved. He says the government will stuff their mouths with money. And that's how it really got started in this, you know, with Medicare and Medicaid, because doctors started getting paid for cases that they were doing for charity before that. And before you know it, they were trapped, they were dependent, and it was very hard to get out of the system. I saw that coming, and that is the reason why, when I was still practicing medicine before I went to Congress, that I refused to participate in any of the government programs.
Dr. Paul, you referenced the sort of growth of Medicare and the entitlements and the sort of system of charity hospitals that it supplanted. Did it drive out the private provision of health care, especially health care to people who really couldn't afford it? Did we drive out the private market of health care delivery for poor people in this country?
No, I think we made it much worse. I can recall in the early 1960s, shortly after I had a license, I worked in a Catholic hospital, and it was both for training as well as making a couple dollars. And I would work for $3 an hour. And it wasn't much money, but I felt like I was doing something. Nobody was ever turned away. So I never saw the people out on the streets not getting medical care. And it has been the government involvement that has driven up the prices, the inefficiency, and the cost going to the middleman and everybody except the patient benefiting. So it's a total disaster. Central economic planning, no matter what you talk about, and especially in medicine now, it's the worst thing in the world. So if anybody cares about poor people getting medical care or making sure they have a decent living, they have to come around to believing that the government isn't the source of solving those problems. The government government creates almost all of these problems, and we have to have a better understanding and a greater trust in how the market works. Today, doctors charge the maximum. Everybody charges the maximum because of third-party payment. And in the old days, everybody charged the minimum, or they would help somebody along. But today, the cost goes up in the hospitals and the labs and the insurance companies and drug companies. Everybody goes to the maximum because they figure they're going to get a bigger piece of the pie. And that leads, of course, to rationing and controls and dictations and telling doctors how to practice medicine. It's a total disaster.
Well, Dr. Paul, a question I've wanted to ask you in particular for a long time is, what are the limits of free market medicine? Obviously, the American Medical Association has a monopoly on both the minting of new doctors and the establishment of educational institutions for the same doctors. They also establish a lot of the rules that these new doctors are minted under, some of which are potentially dangerous. I mean, you have young medical students that are working 40 and 60 hours a week, but I'll stop filibustering and let you answer. Do you think that there is room for other agencies or other organizations to get involved in the process of creating new doctors as well?
Yeah, we have corporate medicine, and it's state-run, local and national, and licenses are used. You should get rid of the licensing programs. I mean, patients aren't protected because I went and got a license. They should have protection because I went to a good medical school, and my patients would tell other potential patients what kind of medicine I practice. But the license doesn't do anything. All that does is exclude the competition, and it should be open. They don't need me to check on a sore throat to give somebody medication. That is not necessary. But licensing and the exclusion, matter of fact, the AMA, in participation with government in the early part of the 20th century, actually closed down hundreds of hospitals that were actually, appealing to minority groups and to women even before that. So the organized medicine closed that down, told them how they should practice medicine, and then, of course, then they had to have affirmative action, do all these other things. You just have to legalize freedom of choice, and you should, and this is a tough thing to sell because a lot of people still think that the customer and the patients are protected against unethical behavior because the government requires a license. But all it does is exclude competition, whether it's real estate agents or whether it's plumbers or carpenters or anything else. The license is always there to protect a special interest group, and in medicine, it's very much the same way.
What about having a free market for organ donation? I mean, right now you talk about a constrained list and the impossibility for really sick people to get what they need. Should people be allowed to sell their organs?
Yeah, absolutely. They should be able to. I participated and sold some of my body in medical school, and I had an incentive and two incentives. I wanted to get $35 for a pint of blood, but I also thought I was doing somebody good. And generally speaking, the blood banks were filled. And bone marrow, now they're starting to allow people to pay for it. No, it should be done in the market. It should be done. Ethics can control this. There can be people, you can't take advantage of people, but there would be a lot of things, a lot of improvements can be done if families and individuals can make those decisions, and there could be even before death, people could sign permission for this. But I think it should be in the free market and not state regulated, because once you get the state involved, you have shortages. And now, then how are those organs distributed? Sometimes politically. If you're on the inside, you might be able to get the liver transplant or the heart transplant and get moved up on the ladder, or you might have a special case and put on political pressure, and all of a sudden they have to capitulate. No, the market could take care of organ transplants, and nothing is perfect, but let me tell you, it would be a lot better than the system that we have today, because we have artificial shortages of organ transplants because of the government regulations.
All right, one last question. If you were in college today, would you still go to medical school and become a doctor in this current environment?
Yeah, I probably would, mainly because overall, I had this incentive to do something in medicine. I have three of my kids are physicians. I never talked to them about going. I never pressured them to go. I never talked to them out of going. But I always thought they had the same motivation, a similar motivation to practice good medicine. And I also believe that even in spite of all our problems today, if they would just give us the right to opt out, the description that was made just a few minutes ago about how Canada finally ruled that a patient could seek medicine outside of the system. And this is why Obamacare is such a threat, because it's trying to make it so you can't go out of the system. But as long as there's an opt-out, the physician and the patients should have a chance. There's a lot of burdens, but what business can you get in today that you don't have to put up with, federal agencies, whether it's EPA or OSHA, land control, FEMA, all these other things. So it's this concept of liberty that is the problem that at this present moment. It's affecting medicine more than anything else. But it's the cause of liberty that we should champion, not just free market medicine, because that's one major segment of it, but it's liberty that we should cherish.
And we do, and we cherish having you on. You can see more of Dr. Ron Paul on the Ron Paul channel, ronpaulchannel.com. Thanks again.
Thank you.
All right, coming up.